hot. Alex, it's hot. It's hot. I'm gonna keep this as short as possible because it is hot. I'm standing in a parking lot in Arizona in the dead of summer. But look, this kind of heat isn't just an inconvenience for a whiny podcaster who walks from his air-conditioned car to his air-conditioned building. It is a real human cost. And for a while, it seemed like that cost was just getting higher. See, starting in 2014, heat-related deaths kept going up year over year, peaking at 645 deaths in 2023. But there's been a glimmer of hope. In 2024, deaths actually went down. And while 2025's numbers are not going to be available until late fall, things seem to be trending in the right direction. Today, we're talking to two people who had a role in that change in direction. The first is Patricia Solís. She, along with her team at the Knowledge Exchange for Resilience at Arizona State University, translated university research into recommendations for policymakers around heat safety. The other is Dr. Nick Staab. He's the Chief Medical Officer at Maricopa County's Department of Public Health. He's on the forefront of keeping people safe and cool in an ever-warming world. Welcome to Lab Coat Optional from Arizona State University, the show where advanced research meets everyday curiosity. I'm your host, Pete Zrioka, and every week we talk to people behind this research, minus the jargon and definitely minus the lab coat. Let's be honest, out here we don't need coats of any kind because it's hot. Anyway, stick with us. We're gonna head back inside. Patricia, thank you for joining us today.
Happy to be here.
Great. Can you tell me a little bit about the mission of the Knowledge Exchange for Resilience and how heat fits into that overall picture?
Absolutely. Knowledge Exchange for Resilience is really set up to be one of these places at ASU where we make one of those boundaries between the intellectual might of the university and the community that we live in.
Right.
You know, we have all of these wonderful assets, both inside of the university and outside, where we can exchange data, information, insights, and that's really where we sit, trying to solve problems.
And you look at everything from housing to economic security, and then heat kind of spans all of that in a place like Maricopa County, right?
That's right. When we think about resilience, we think about what are those things that are the persistent threats that we face every day that sort of color everything that we do. And here in Arizona, heat is really one of those things that we face year after year.
Yeah.
And it's something that really affects our lives. It affects our livelihoods and affects everybody differently, of course, but it's one of those things that we really have to reckon with all the time.
And it's something we deal with quite frequently. In fact, in 2023, the governor declared a state of emergency and established an Office of Resiliency. And that director of the office looked to your group to figure out recommendations. Can you tell me a little bit about that and how you helped them form a plan for how we're going to deal with heat emergencies in the county?
That's right. We were really proud that we were available to respond to the public, to the state when they really needed us. 2023 was the hottest year on record at that point until 2024 came along, and then that was the hottest year on record.
And 2025 remains to be seen.
Yeah, fortunately, we're a little bit cooler this year, but that was really something to be, something we really needed to respond to in 2023. Up until that point, year after year, Maricopa County and Phoenix in particular, we just year after year have seen record illness and heat-associated deaths. And despite our best efforts and increasingly responding, the community coming together, it just was continuously on the rise. Extreme heat is actually not one of the official disasters, believe it or not like a hurricane or a flood. FEMA doesn't actually consider it a natural disaster. And so
we can't get funds, we can't get relief from the federal government for something like that.
That's right.
Yeah.
And so the governor did declare it for the first time that, as far as we can tell, that a state has ever done that. And so that was a way that the state was able to pull in more resources for cooling centers. And in that executive order, there was also a call for a way to bring other state agencies. There are 10 state agencies named in that executive order, and directing the Office of Resiliency to say, let's be more resilient. We need to come up with the state's very first extreme heat preparedness plan at that level, a statewide level, so that the whole state could respond and move it beyond the public health and emergency response in piece-wise that we had been doing up to that date, and elevate it even that much further to get new resources involved.
Can you tell me about some of those new resources and kind of give me a brief sketch of what the plan entailed?
Well, the plan itself did respond in the ways that the executive order called for it to create new cooling centers and bring in the housing department, bring in the transportation department in some new ways. Even the lottery got involved in creative ways with communications in ways that never had actually saw their role before. But the lottery touches people's lives. People see messages. So some really creative things happened that had never actually been contemplated before. So you could see that the ways that the power of getting new actors involved could really get messages across, get communications, get some coordination. And so we really had a short amount of time. This happened in August with the declaration. The Office of Resiliency called upon our team at ASU, the Office of the Knowledge Exchange for Resilience, in September. We got our report of recommendations back to them in January. Quick turnaround. We could not have been able to respond that quickly if there hadn't already been years of research at ASU, University of Arizona, Northern Arizona University, all the practitioners across the multiple counties that have been involved that we could just tap into and say, what is it that we've learned together over these years in responding to this, and put out a call to the public. What are the kinds of things that we're doing that are working? What are new things that we need to be doing that we could recommend? And put that all together quickly and talk to all the agencies involved multiple times, and put our best ideas forward that could be put into that plan. One of my favorite ideas that I'm so happy that they took up was to put in place a state chief heat officer. It was the first in the nation to do something like that. And they did put it in the plan, the first in the country. And Dr. Eugene Levar has filled that role now, and he's doing a great job with that.
So we're touching on housing really quickly. You said housing got involved in this plan in a way they'd never been before. So, I mean, obviously, if it's hot, you need shelter. You need climate-controlled shelter. What kind of policy was implemented on the housing level that helped people in extreme heat situations?
Well, a lot of this is coordinating some of the programming and the resources that already exist, and maybe putting additional resources in there. Housing and energy together, for example.
If you have an apartment but you can't pay the electric bill, or you can't pay to get your AC fixed, you're not helping yourself, right? Yeah,
and we still have a long ways to go, of course. If you look at heat-associated deaths, I'm going to take Maricopa County because that's where we have a lot of the best data. Over the last decade or so, if you look at just in general terms, most of the people who perish from heat-associated deaths that are indoors, they're usually because they just did not have adequate cooling. Most of those, almost I would say 100% of those could be avoided. Wow. Because the housing is inadequate, or they didn't have electricity. For example, let's take mobile manufactured homes. These are the older models are notoriously harder to keep cool.
Right. No insulation. It's
low insulation, especially the older homes. Yeah. When they depreciate, and it's really hard to keep cool in the Arizona sun. So we've been working with the utility companies to help disseminate information. We have all sorts of ASU and the Knowledge Exchange for Resilience. We've worked with the residents, and we've worked with utilities to put out a guide for solutions. So things like where to get the materials and awnings, to put over your window units. To keep them cool, to keep the sunlight directly off of them, where to get the materials to put in your windows. What can parks do to help, create a place for people? Each park should have an emergency plan if the power accidentally goes off, because sometimes the residents don't know who to call. They think to call the utility company, but what if it's their landlord that is the one with the power? So all sorts of information that is really important to have. We've come a long ways in the last few years with just sharing information about the disproportionate risk that people who live in mobile manufactured housing face, and just the information to residents themselves.
And your group
to protect
was
them.
Part of an effort to get legislation passed to help people living in manufactured mobile homes, correct?
That's right. We were working with the Residents Association, the Arizona Association of Mobile Manufactured Homeowners, AMHO.
Yep.
When we were distributing this guide, it was wonderful. We printed it about 4 times, and they were sending it all around the state. And then we started hearing that there were, unfortunately, some land lords that were saying, well, you can't really put that trellis there, or we don't want you to put that window unit in the front of the house, even though that's your bedroom, because that looks bad. And
that's because they own the land, but people own their homes, but they lease the land. So the landowner had the final say in many cases.
Well, that was debatable.
Okay.
But it wasn't quite clear. So anyway, this needed to be clarified, right? And there is an act that governed the relationship between the landlords and the tenants, and to make it crystal clear, there was a proposal to put that explicitly in that agreement, and I was able to testify as to that amendment right about that same time in early 2024 to make sure that landlords cannot prohibit tenants from, saving their own lives, putting commercial cooling, any kind of cooling technology into their homes. And so that passed, unanimously in the committee, and unanimously in the Senate, unanimously in the House, and the governor signed it with an emergency order so that it was already in place in that next summer. So we're really proud that the research, cooler heads prevailed and saved probably some lives that next summer.
And not only it was the research that helped empower this, but it was like the connections that you had made with homeowners and people on the ground, people who knew what their circumstances were.
Absolutely. The true meaning of knowledge exchange. We learned a lot from our residents, the research that we did with the community. In fact, we published papers on this, and they were some of our co-authors. The little old ladies in the parks were some of our co-authors that we exchanged knowledge with. So it was a really wonderful experience all around.
It's a nice thing to put on their resumes, too.
Absolutely. We loved it.
So in terms of the plan that you helped put together for the state, what is the dialogue after that plan is put into place? Is your group kind of evaluating and monitoring how these measures are taking effect? Like, what is the back and forth like, if there is any?
Absolutely. We're still in touch with the Office of Resiliency, of course. It's very important that we're on top of all of the needs of the public. I call it a first mile approach.
Okay.
We don't wait till the last mile of the research and say, well, here's our research and let's throw it over there and what can you do with it?
Right.
From the very first mile, we're in touch with the community and say, what are the questions that really the public needs? And that's what we want to focus our research on. That's what knowledge exchange is all about. So, in fact, we're asking questions right now. And you've probably seen in the news that our senators, Gallego and Kelly, are asking some of the questions that we've been asking. What is the cost of heat in lost productivity? What is it? Our wallets, our health, our well-being. We're working with the Federation of American Scientists on a national level with trying to estimate some of this, and early preliminary thoughts about this is it's as much as 1% of our national GDP in terms of what our infrastructure, the materials and our roads and our buildings and our bridges and the toll on our health and our workers. So it can be quite a lot what heat is costing us.
Yeah, and there's a real, as you alluded to earlier, there's a real lack of like federal heat policy and heat safety policy. As you noted, heat emergencies aren't recognized as a disaster under the Stafford Act. We cannot get support for them from FEMA. And then there's only a handful of states that have specific laws governing heat-related occupational safety. So OSHA doesn't have any laws about it. It's all mostly regulations. So like, other than getting senators involved, how can we promote nationwide heat safety policy and export the things that we've learned here to other places?
Yeah, that's right. And I think Arizona is leading in this. A few other states as well are joining up on that. Also, Representative Stanton recently also pulled together with other states a national heat caucus. And so we're also very supportive of understanding what kinds of things in terms of protecting our citizens, what kinds of things can we do for our economy, our workforce, not just in terms of protection, but in terms of, looking forward. One of the ways that we can solve some of our heat issues, we could solve more than one problem at once. We can deal with some housing issues and workforce issues at the same time.
Yeah.
We do have some affordable housing things that we would like to deal with, and we also want to create a really great workforce in Arizona.
Yeah.
So what if we put two and two together? Maybe we can make some heat smart working housing.
Yeah.
And, really transform.
Yeah.
I do believe that we need to stop talking about extreme heat as just the individual's problem.
Okay.
Drink more water.
Right.
Don't go out in the heat. Take care of yourself. You take care of you. That is just reducing it to just the individual's, one person's public health problem, which doesn't really work for extreme heat, to be honest with you, because by the time that you realize that it's coming to hit you, you felt it, haven't you?
Yeah.
Yeah. By the time it kind of hits you, you're not really able to take care of yourself.
No. You got to sit down and hopefully you don't throw up. And hopefully someone's around to give you water.
That's right.
Yeah.
It's more than you. You got to watch out for your neighbor. You got to go
Mm-hmm.
check on your neighbor. It becomes a we thing. And we have to take care of each other. And there's a moment when we all have to, think about as a bigger issue. And it becomes more than a public health issue. It actually does become, it kind of bleeds over into a disaster issue. And increasingly, as the world gets hotter, and it is, we have to really think about all of the ways that is affecting us, our lives, our livelihoods, our infrastructure, our communities. And we really should, start preparing a little bit better for all of it.
Well, and speaking to the individual piece of it, like if there were rolling blackouts in Phoenix when we were hitting if we were hitting 110 and there's rolling blackouts and no one has AC, like you can't expect everyone to fend for themselves. Is everyone supposed to have a backup generator? Like, what do you want us to do? Like, that's just not. It's not reasonable for everyone to deal with it.
There's different levels and different phases and different dimensions to this problem that we're going to have to reckon with, and so we need to think it through in much more serious ways. And so that's what we've been trying to do, and elevate that. It's just that heat is a little bit invisible. Yeah. It looks like a sunny day. So it's a little hard to wrap your head around. And it does affect different people in different ways. It's easy to see that hurricane coming. And it's a little easier to predict where that flood is going to hit, exactly how it's going to hit. But on the other hand, temperatures are actually quite predictable. Yeah. So we should be able to get our heads around it. We need to invest in that. We've got really good science. We need to pay a little bit better attention to that, invest in it, I think, and take it a little bit more seriously. It's a little bit of a more difficult challenge than the types of hazards and challenges that we've dealt with in the past, but we could do it.
Well, Patricia, thanks for coming on the show.
Thank you for having me.
Thank you again to Patricia Solís for joining us. Now that we've explored some of the research and work that helps inform policy, we're going to talk to someone who implements it. Up next is my conversation with Dr. Nick Staab, the Chief Medical Officer at Maricopa County Public Health Department. Nick, welcome to the show.
Thank you.
So I wanted to learn a little bit about the heat safety strategies that the county implements to help people. What is the county currently doing, and how have those efforts evolved in the recent past?
So public health has kind of taken a leading role in organizing a variety of different responses to extreme heat. So during the summer, we, along with the Maricopa Association of Governments, runs the Heat Relief Network, or the HRN. It is a system of cooling centers, so respite centers, cooling centers, hydration stations across the county, where people can go and get out of the heat and stay hydrated. Over the last couple of years, we've put in a lot of effort to expand the Heat Relief Network, expanding the hours of operations of the cooling centers, as well as increasing access by providing transportation and more communications, including partnering with 211 to make sure that people can find a cooling center when they need one.
And I take it when this network of cooling centers, they're all throughout Maricopa County. They're in Tempe, they're in Phoenix, Scottsdale, you name it.
Correct. So all across Maricopa County. In fact, we have worked with partners at ASU to make sure that the locations of those cooling centers are optimized based on our data, knowing where our heat-related deaths occur and where there are other issues to access. We've really been able to optimize the locations of those centers.
So you mentioned access and transportation, right? Like getting people from wherever they're isolated or where they might not have access to a cooling center to the resources they might need in a heat wave or just, a standard day in Maricopa County.
Sure.
Are you also working on outreach and making sure that people know about these things and can access them if they need them?
Yeah. So historically, the Heat Relief Network has really functioned off of a online map that shows where those cooling centers are. So we have done a lot of communications around that map, how to access it, and making sure that it's reliable, that it's updated with the real operational hours of each of those centers. But we know that those individuals who are at highest risk may not have access to the internet. And so we partnered last summer and again this summer with 211 so that folks can just call in there, find out where the nearest center is. And again, if they need assistance getting to that site, we have a transportation benefit through 211 to get there. We also know that most people who are using cooling centers find out about them by word of mouth. It's just, where they are locally in their community. So we've also been putting a big effort into just getting out cards with the 211 message on there so that people can know that that's a resource for them in the community.
Old school marketing. I mean, that's somehow the way you do it, right?
Yeah. And signage. Consistent signage on the streets is another big thing. Last year, we partnered with the city of Phoenix to print a lot of just A-frame signage, as well as, again, this summer, making sure that all the heat relief networks have that consistent signage out on the sidewalk or street.
So you mentioned that not everyone necessarily has access to the internet to look at the map. That leads me to think that there are specific populations that are more vulnerable to heat illness and death. Can you talk a little bit about them?
Sure. So we have data going back to 2006 that looks at the risk factors for heat-related death in the county. There are a couple of populations that are at higher risk. We know that individuals who are unsheltered, who are experiencing homelessness, or who have unstable housing are at high risk. Older individuals over the age of 50 really are at increased risk, especially when we look at our indoor heat-related deaths. We see that in the older population. Individuals with underlying health conditions are at increased risk, as well as those who are using substances. And when we look at that data specifically, while there's a lot of attention to the opioid epidemic, It's really individuals who are using stimulants like methamphetamines who are at highest risk during the heat season.
That's a range of different people, right? So they each represent populations with their own challenges. Do you try to tailor the resources that you deliver to each of those populations based on where you're meeting them?
Yeah, so it is a wide range of risk. We also like to say that everyone who's visiting or living in Maricopa County is at some risk from the heat. So everyone needs to have a plan. At any point in time, you may find yourself without a reliable source of cooling and may need to access this system. So that's a really important part. And then when we start to look at these specific populations who are at risk, these are populations that are at risk for a variety of public health issues, not just heat. And so there are programs that we are running and communications that we are reaching out to around, all year round, that during the summer, we specifically talk about heat and how that's an added risk factor for them. So there's a lot of opportunities, I think, to add heat messaging to a lot of existing messaging that we have going on.
Right. So I was looking at your background a little bit. You have a master's of science in public health. I was kind of wondering, you're a chief medical officer, so I assume that encompasses more than just heat-related illness and death. Did you think that you would end up working on heat in such an intense way in this capacity as a medical officer?
I'm a public health physician. I'm a pediatrician by clinical practice.
Okay.
I'm a native Phoenician, so I grew up here, spent a lot of time training and living elsewhere, but came back to Phoenix. I think when we think about public health, we think about treating the health of the community. There are a variety of risks that may put us at risk of being in poor health, right? Mm-hmm. So heat is just one of those components. So I think traditionally we think about infectious disease. We think about how the community is impacted by outbreaks or COVID-19. But heat is another one of those risk factors. And so we apply, maybe I didn't think about it 20 years ago that heat was going to, take up all my time during the summers. But this is Arizona and Phoenix. Maricopa County is a place dear to me. And so I will continue to really prioritize this work because it's a high risk to our community.
Health is environmental, right? Like be it extreme heat, extreme cold, air quality. There's a variety of things that impact people and a population's health based on where you're situated.
Absolutely. And then, I think the other thing is public health has really taken a transition to really focus more on those underlying factors that are affecting individuals' health, that aren't just infectious diseases. So when we look at the social determinants of health and we look at how our communities have disparate risk factors depending on where you live and the conditions you live in, all of those are things that we are more and more tracking, gathering data for so that we can, again, prioritize and be more efficient in our operations.
Great. So I also wanted to talk about the relationship between university research and how governments implement strategies to mitigate heat illness and death. Specifically, I spoke with Patricia Solís, who leads the Knowledge Exchange for Resilience, who they have done a lot of work on heat resilience and how we can help populations stay healthy in the midst of extreme heat. Can you talk about the exchange that your office has with those type of organizations and other universities that not only inform your work, but maybe validate it?
So we are very fortunate to have, I think, really strong relationships with our university partners in Maricopa County. It has been a long-standing relationship that I think continues to grow and adapt to the challenges that are coming. There are strengths of different organizations, right? And so I think we recognize what each organization has to bring to this partnership. Public health, by our statutory authority, has access to data that other organizations may not, whereas our university partners have a lot of very technical expertise that we don't necessarily develop at the public health department. So by bringing those together, we are able to achieve, I think, a high level of success when working together. So, I mentioned that we worked with ASU to really optimize the locations of our cooling centers. We've worked when we're looking at indoor heat-related deaths. A lot of those individuals are living in either mobile homes or manufactured homes that are not as well insulated as a fixed building. And so, looking at how we do outreach to those communities and identifying where those communities are that are at higher risk is really critical to our effort to protect people from the extreme heat.
So, as we've spoken about, the county and your office in particular does a lot to support people vulnerable to heat. I was curious if there's anything individuals can do to help mitigate heat-related death and illness, not only in themselves, but their communities overall.
I mentioned earlier that everyone has to have a plan, right? So knowing your own risk, whether you're a young, healthy person who may just find themselves suddenly without air conditioning, or, maybe you're a person who enjoys spending a lot of time recreating outside, knowing when it's safe to do that and not. Like, all of us have to be aware of that and have a plan. So that's the first step, knowing what your own individual risk is. Right. The next is really looking at the community, your own community, your family, your friends, neighbors, knowing who might be at risk there, and making sure that we're helping each other throughout the heat season. Our heat season is long, and it seems like it's always getting longer. And so, we need to make sure that we're not, losing sight of that goal to keep each other safe during the heat season. So I think that's a big part of it too, just making sure that we're checking on one another. We know especially the older population, and again, talking about those indoor related heat-related illnesses and deaths. Oftentimes those are individuals who may be living alone. And if we just make sure that we're watching out for each other, I'm hopeful that we can continue to reduce the number of heat-related deaths each summer.
My last question for you, if you could implement one ideal strategy, resource, or infrastructure to help mitigate heat illness and death in Maricopa County, what would it be?
We need sustained funding for this effort. So, we have been fortunate the last couple of summers to have funding that was related to pandemic recovery dollars. That funding is going to go away. And operating these cooling centers is not free of cost. So we are fortunate that a lot of community-based organizations, faith-based organizations, cities and towns are all stepping in to help with this. But again, in order to serve people who are at risk for extended hours, for weekends and holidays, we've had a lot of success with the 24-hour sites that have been opened up. That takes funding. And so I think the more attention we can draw to this, both locally as well as nationally, we are going to be more successful in really prioritizing funding to go into this effort. The heat's not going to go away. Again, we are fortunate in some ways that our extreme weather event is very predictable. But it again takes a community-wide response, it takes funding, and we really need to prioritize it so we can keep people safe.
Yeah. Write your lawmakers, folks. They need funding. Okay, I think that's all I had for you, Nick. I really appreciate the work you do. I'm deeply grateful for it. And thank you so much for coming on the show today.
Great. Absolutely. Thank you, Pete. I appreciate the attention to this topic.
Thank you for tuning into Lab Coat Optional. We are a production of the Strategic Marketing Communications team at Arizona State University's Knowledge Enterprise. Knowledge Enterprise is led by Executive Vice President Sally C. Morton. If you enjoyed the show, leave us a review on the podcast app of your choice. And if you found us on YouTube, please like and subscribe. We are at the mercy of the mighty, fickle algorithms, and stuff like that helps people find the show. As always, lab coats are optional on this show, but we want to keep our researchers safe in the lab. So wear your PPE. Until next time, stay curious.